Other findings with facial features, we'll start with Pierre-Robin. Now, Pierre-Robin is not really a syndrome per se, it's a sequence. What happens with Pierre-Robin is that in utero you have mandibular hypoplasia. What that does is then it pushes the tongue up and prevents the palatal shelves from fusing. So when the baby is born, the tongue looks relatively large in relation to the mouth, and they may well have a cleft palate because of the prevention of the palatal shelves. This is something that is found as part of a syndrome, not necessarily a syndrome in and of itself. Certainly you can see where a large tongue in a relatively small jaw and mouth can cause airway problems. So these patients can have major airway obstruction. Sometimes they will need tracheostomies. If they're born and they're having airway problems, the first thing to do is try turning them onto their stomachs. That helps the tongue to flop forward and out and relieve that airway obstruction. Many of them will require tracheostomy. If it's an isolated finding and not associated with any other syndromes or other associations, then these patients tend to be otherwise normal. Here we see a picture of Pierre-Robin sequence, and you can see that very, very tiny chin and the mandibular hypoplasia, and that would cause the relatively large tongue in the mouth. Waardenburg syndrome is autosomal dominant, and you will have to know modes of inheritance, because one of the questions that they might ask is they'll present a patient and give the description, and you'll say, oh, it's such and such a diagnosis, and they might ask, what are the odds of having another affected child? Remember, so you need to know that the modes of inheritance. If it's autosomal dominant, then probably a 50-50 chance, depending on what the father is or the other parent is. And certainly if it's an autosomal recessive disease, then it's a 1 in 4 chance of having another affected child. It is associated with an older paternal age in this case. Look for the classic partial albinism. They'll describe what's known as the white forelock of hair, or a white shock of hair. We'll see the picture in a second. These patients tend to have a lateral displacement of the inner canthi of the eyes and along the palpebral fissures. Sometimes you can also see this, the eyebrow kind of flaring inward, almost to form one unibrow, basically. And there you see that white forelock that is seen in Waardenburg syndrome. It is autosomal dominant, so you will see it in successive generations. They also, there's an association with deafness and Waardenburg syndrome.